the Automated External Defibrillator, aka the AED. AEDs are found in many public locations such as schools, gyms, airports, malls, Sobeys, grocery stores. They're found in many public places because if someone needs to use it, you don't need very much training because it talks to you to use the device, okay? So they're very portable, they're commonly available. Just some things about the AED. If you want to turn to page 50 of your textbooks here, if you follow along, a casualty who has suffered a cardiac arrest, meaning their heart stopped, has the best chance of survival and recovery if the AED is used within 4 minutes of the cardiac arrest, okay? So if the casualty is unresponsive, has no pulse, what the AED does is it resets, quote, the heart and allows the heart to kind of reset itself, okay? Very technical words here on page 50. The AED analyzes, so you don't have to interpret the rhythms yourself. The AED does that for you. It analyzes your heart's electrical rhythm, and if it determines the rhythm is one of two, ventricular tachycardia or ventricular fibrillation, the AED will say, oh, okay, that's a terrible rhythm. We're going to stop that rhythm by shocking the heart. So the heart resets itself, okay? So the AED delivers a very large electrical shock, and what it does is it stops all electrical activity, again, so the heart can reset itself, okay? CPR will be interrupted in order to use the machine, okay? So very important, while the AED is analyzing the rhythm and while the AED is shocking, no one is touching the casualty, okay? So in order to use the machine, if you follow along on page 50, the treatment steps, make sure you're in a dry area, okay? So AEDs do come with a little towel to remove any moisture, but it won't remove a puddle. So if there's enough liquid, it's called a splash test. If there's enough liquid to splash, that's too much liquid that puts you, first aider, at risk of getting shocked. Okay, so you either have to move the person into a drier area or it's not safe to use, okay? So step one, turn the machine on. You're gonna find the on button and you're going to push it. A little voice comes out of the machine. It tells you exactly what to do and how to do it, okay? Remove any clothing, every piece of clothing on the chest and any objects that might come into contact with the pads, okay? Like jewelry, place them behind the neck, okay? Number two, ensure the chest is dry and free of excessive hair, so the pads will stick. Shave the area if needed. So they do come with a single blade razor to hack away the chest hair if there's a lot of chest hair in the way of the pads. And again, the pads will sit on your chest. There's a picture of where to place them. So just look at the picture and place them as shown. Number three, follow the prompt, so it tells you what to do. So just listen carefully, don't get ahead of it, don't fall behind it, sort of thing. Ensure no one's touching the casualty while the AED is analyzing, and if prompted to give a shock, make sure everyone's clear. So no one's touching the shock button or the person or the machine or anything by saying, I'm clear, you're clear, we're all clear, so no one gets injured here, okay? Number four, once the shock is delivered, we're gonna resume CPR, starting with chest compressions. It times you for 2 minutes, so after 2 minutes of CPR, the AED will then reanalyze and then may prompt for another shock, okay? This can be repeated until essentially EMS arrive, okay? Special considerations for AED usage. If the casualty is wearing a medication patch where the electrodes are to be attached, that patch should be removed. So using gloves, because you don't want to touch the sticky part, that's how the beds go in your body, remove those patches, okay? If they have a small scar, lump, it's a matchbox shaped scar underneath their right collarbone here. It's a slightly raised scar. It's an indication the person has a pacemaker. So the pad that goes near that area would go at least an inch away from it, so you're not shocking the pacemaker, okay? So pacemaker's here, 1 inch pad, okay? Blah, blah, blah. An AED can be used on a pregnant woman or anyone who does have serious injuries. And then Yeah, they're most successful when they're used within 4 minutes of the cardiac arrest, which is not that much time. But if the AED is in your building, then the chances of you getting it is actually quite high. Okay. Yeah. The AEDs do have special pads. These are adult pads. They're quite large. They fit onto adult torsos. If you have a child, there are special child pads which have less energy and they're smaller. They will fit better on a child's torso. There must be 1 inch gap between the two pads in order for the pads to meet and shock the heart. Okay. Now, here's a tricky situation. You only have adult pads, but you have a child casualty. So in that situation, yeah, you can still use the AED, just the pad placement is a little bit different. So instead of placing one left and one right, you're gonna place one on the front of the chest, on top of the heart, and one on the back, okay? Kind of behind the heart. So it shocks front to back instead of left to right, okay? Yeah, so that is all that. I'm gonna demo the AED on my mannequin here. So I've already gone through the sequence of stop, checking for breathing, getting my consent, calling 911, bring back an AED. If you don't ask for one, you're not gonna get one, right? So go get that for me. I'm starting compressions, okay? 1, 2, 3, 4, 5, 6. Now I do CPR until the AED arrives, okay? 28, 29, 30. Barrier device on, 2 breaths, or second rescuer can help me with 2-person CPR, okay? When the AED arrives, okay, the first thing I'm gonna do is find the on button and push it.
Apply pads to patient's bare chest.
All right, so I'm gonna remove the clothing.
Plug in pads connector next to flashing light.
And listen to it. So remove clothing, apply pad to person's bare chest. So he's quite hairy. I'm gonna hack away that chest hair.
Pads, plug in connector.
And it repeats itself till you do the steps, so don't worry about it shocking you. Apply pads. So that one goes, there's a picture of it, okay? It's gonna go right here.
Apply pads, plug in connector.
I don't see a pacemaker, nor do I see medication patches, okay? I've applied the pads, so it shows me plug-in connector next to flashing yellow light. That's the connector.
Apply pads, insert connector firmly.
Okay, make sure it's firmly connected.
Analyzing heart rhythm.
Okay.
Do not touch the patient.
It's reading the rhythm he's in, whether it's VT or VF. You don't have to know what they look like.
Shock advised.
Okay.
Charging. Stay clear of the patient. Deliver shock now. Press the orange button now.
So it's telling me to push shock. So I'm going to say, I'm clear, you're clear, we're all clear. Shocking now.
Shock delivered.
All right.
Start CPR.
All right, so I'm going to compress. Okay, gives me a nice little beat to compress to, which is really nice. Okay, I do this for 2 minutes, and after 2 minutes of CPR, I'm going to, well, the AED tells me to move aside. It's going to analyze the rhythm. Okay, 30 compressions followed by 2 breaths, 30 to 2. Okay, I'm going to turn that off. Oh, let me just turn that off. Okay, so that is the AED. Fairly user-friendly. It's designed for people to use who have very little first aid training or knowledge while they're panicking. So they're very easy to use. Okay. Let me just see here. Yeah, so AEDs, just important for employers to note. They are part of an employer's emergency response plan and first aid program, so your employer should ensure regular maintenance and inspection of AED equipment, which includes verification of the AED status and condition, checking the pads because they do expire every few years, and checking these accessories. So little towel, making sure there's CPR barrier, gloves, batteries are charged, cleaning the machine. Okay, there's instruction manuals in those devices, and the instructions are there. Or you can check the Occupational Health and Safety website in Alberta. That gives you more information. Okay, good. And so now we all practice using the AED.